And I have so much to say about Dr. Taylor Reyes. And yet I'm going to keep it really short because I want her to tell her story. I want her to tell how she got from how she became so passionate about what she's doing in addition to her work as a physical therapist, but also how this all ties in to what her recent trip to Guatemala and to her the journey that she's been on. And I will say that Dr. Taylor Reyes is the owner and lead physical therapist at Fire Physical Therapy. She was trained in obstetrics and pelvic floor physical therapy most recently. But she does have her bachelor's degree in kinesiology and exercise science from Texas Women's University, her doctorate of physical therapy at Hardin-Simmons University, and is a certified in functional manual therapy from the Institute of Physical Arts. As her office is here in the Dallas area, and she treats patients from all walks of life with varying issues. She has passion for teaching people with chronic pain how to modify their mindset and lifestyle so they can have more empowered healing journey. The belief that exercise, nutrition, and sleep are the pillars, excuse me, of optimized healing deeply rooted in her practice and personal life. Dr. Reyes and her family practices these pillars through adventures in nature, joys in cooking whole foods, and prioritizing rest. In 2014, during a clinical internship in Guatemala, she had the opportunity to volunteer at a local prosthesis clinic and wheelchair shop, Transformation Foundation. The employees and clients of the organization touched her heart deeply, and therefore Fire Physical Therapy gives 10% of every initial evaluation to this foundation annually. And talking about someone who walks the talk and is truly grounded in holistic health, I'd like to give the time over to Dr. Taylor Reyes.
Thank you for that. So kind of like Kathy was saying, I've been really fortunate to integrate my professional goals as a student back in the day into my current practice. And that's one of the perks of being a business owner, right? You can just do what you want. So when I graduated physical therapy school, I wanted to do women's health and I wanted to do medical missions. And I wanted to do functional manual therapy, which I got to do that. And women's health segued into, everybody could benefit from pelvic floor physical therapy. So I don't just see women for that. And then with medical missions at the time, when I started my practice, I had a 6-week-old baby. So getting up and going wasn't really an option. So I thought, well, I'm just going to give 10% of each initial evaluation to this prosthetics clinic and wheelchair shop that was really important to me. My mom is from Guatemala, so I do have connections there originally. So it's also really special to me that I've been able to serve people in that country just the same way we'd want to serve people in our community here. I feel like I get 2 communities that I get to serve. So that's been really special. So most recently, in the last couple of years, I've partnered with Belle and Sparrows. It's a nonprofit organization here in the Dallas area that I created a little presentation, so I'll share more about what they do specifically, because I think everybody will really just enjoy their mission statement, because it's definitely about giving women a hand up and not a handout in the community. So I was invited to serve in Guatemala with this group in 2020. So this is personally my second time going back to this village, but I will share a little more specifics here. Let me pull up my little presentation I have for you all. Okay. I'm gonna do screen share. Okay. Sorry. One moment, please. Okay. So as you can see here, this is just a sweet little picture I took outside of the village we went to. The history of where we went, you can see down here, there's a couple, Carlos and Heidi. They, back 20 years ago, they partnered, they basically found this group of people up in the mountains in Guatemala, and they were homeless. They were driven into the mountains from guerrilla warfare, and their land had been taken from them. So these missionaries basically walked alongside this group of people to help them get a loan, to get their money, or to get their land back. And then they walked alongside them to also start building shelters, like little cinder block houses. And it has eventually progressed into a school, a church. The government has come in and put in an elementary school. So there's a lot of progress in the village. And then the picture down here, this is Lindy Griggs and Tiffany Savage. They are the co-founders of Belle and Sparrows, which I'm going to share a little bit more with you about in a little bit. So they partner with the missionary couple, Heidi and Carlos of Casa de Mi Padre. So one thing that I think is really important about when you're doing any type of mission work or service work is follow-up. And the fact that they're able to go back, Belle and Sparrows goes back to the same village every year, and that we have missionaries there that live alongside these people, that see them regularly, that we can call and check in on, I think is very valuable. And whether it's the entrepreneurial skills that Belle and Sparrows comes in and teaches the women of the village, or the medical care, or even just the theology, there's always consistent follow-up, and there's always a connection. So one of the main tasks that Belle and Sparrows does when they come into the village is they teach the women how to increase their return on investment in the textiles that they make. Because, you know, those beautiful tapestries that you see in different countries, it can take 4 months to make. It can take $75 to $100 to make, which for them is a significant amount of money. And then by the time they get from the top of the mountain down to a market, which is a multiple day process, they run a booth to sell their products, they're not even breaking even. So we teach them different ways to use the textiles they're making, so they don't lose tradition, but they're still able to keep just increase their return on investment, basically. So this picture was specifically from this last trip in the village, and I just think it's so sweet because you can see the kiddos hanging around their mamas, and you can see multiple generations in the picture. There were 5 of us on the trip this time, so normally more go and can kind of hang out with the kids, so moms get alone time, but you know, it is what it is. We were the first group back in the village since the pandemic started. So this, just a quick little introduction. This was our team. So we had Lindy Griggs, she's the co-founder of Belle and Sparrows. We had a nutritionist go with us, Whitney Stewart, and then of course another member of Belle and Sparrows, and then a midwifery student, which I was super excited about because, as you all know, one of the main facets of this trip was serving the midwives and collecting the supplies. So here's this is a quick little 2-minute video to summarize what I just said, plus a little bit more. So we're just going to watch this real quick.
We turn on the sound.
Yeah. I'm not really sure how to do that.
What you'll do is go up into the area where you're sharing, and it says use share computer audio.
Share sound?
Yes.
Okay.
Homelessness.
Is that better?
Yes, but you can restart it.
You would think I would know these things. Okay.
Off we go to Tabacal, a village in Guatemala that you won't find on any map. 20 years ago, 2 missionaries partnered with a group of indigenous Mayan people who had been driven into homelessness into the mountain forest after guerrilla warfare. Long story short, they walked alongside these people and helped them create a sustainable village with sturdy shelters, a church, a school, and now even a water filtration system. This was an elementary school that is paid for by the government. Unfortunately, 2 years of the pandemic, no school. Here we are. Look, you can see the school and the church. Hooray! off we go. Here's that water purification system I told you about. It's ozonated. Like, how freaking cool is that? Here we are, Whitney, amazing Whitney Stewart, doing a nutrition workshops with the high school students of Tabacal. And then here, Belle and Sparrows going through an entrepreneurial workshop with the women of Tabacal, teaching them how to increase their return on investment. Oh, look, Carrie got to hold a baby. I'm so jealous. Okay, and then Liz, our awesome midwife student, teaching the women of the midwives, or the comadronas, who are birth attendants, basically a postpartum placental hemorrhaging workshop. Like, hey, are we comfortable with it? Do you know what it is? What do we do if you're not? And then speaking of midwives, this is Sabina. She is awesome, and she is the reason why we collected all the supplies to bring to the midwives, like gloves, blood pressure cuffs, gowns, etc., etc. And these are some of my sweet little family people that I got to treat in our pain clinic. And then at the end of our trip in Tabacal, all the women bring their tapestries, and we have a little mercado to shop. This was actually one of the first times they got to sell anything since the pandemic started 2 years ago. And then off we go down that half-mile trek up and down to the village. Hooray! Oh, look, there's some coffee drying on the roof. How fun. And that's an example of one of the sweet little casitas, the shelters that are in the house. Then we got to do a workshop with the women in Santo Tomas, some more entrepreneurial stuff. I did a little bit of pelvic floor education and stretching, yay. And here we are, freaking awesome women doing freaking awesome work.
Okay, so hopefully that was a little, kind of puts a name to a face a little bit more with the goal of the trip and the area we were in. But circling back around to, what everybody has been so generous with is in 2020, when we were last there, Sabina, the midwife that was highlighted in the video, she was saying that they could really use things like gloves, gowns, blood pressure cuffs, etc. And that was pre-pandemic, right? Like those items were luxury, not even without scarcity here in the United States. So, we wanted to honor that, and we were able to collect so much supplies thanks to the chamber and various Rotary clubs, which I'll thank in a minute. But there is a picture here of some of the supplies that we bagged up. We had much more than that. And unfortunately, we weren't able to get a group picture this time around, mainly because we were trying to limit groups in the school just for wanting to reduce spread of COVID. We were worried about possibly bringing COVID into the village since they are so remote. They, especially because the government hasn't been up to the village to vaccinate and that kind of stuff. But what we did find is that we were able to provide a lot of education on, what the virus is, and, the concept of being out in natural air and not being super confined, keeping ventilation. And some of the midwives had gone into the city for a training and, had kind of brought back some respiratory issues anyway. So it was like, okay, well, we're not bringing any new germs into the village, and we all had our tests. So, but this picture here on the right of that's Sabina walking away with her big bag of goodies that we were able to give her. And it just, you see that and you're like, man, I don't know, it touches my heart. But she's off on her trek, like a quarter mile away to her house, and that's where she'll keep all of her stuff. And whenever she gets a call on her little flip phone that a mom's in labor, she'll just pack up and go, and she just walks there. So Liz, the midwife, she did a postpartum placental hemorrhage training for the midwives of Tabacal and midwives of local areas, because a lot of these women, especially the one that's in the blue gown and the yellow apron, she delivered all of her own 10 kids. So they're not, new to the concept of labor and delivery, and they've experienced a lot of things, but they don't have formal training. So there were items that we wanted to make sure that were clarified to some of the midwives that maybe weren't as experienced. And technically, they're called comadronas, which are like more birth attendants. Midwives in Guatemala do get a little upset if we refer to these women as midwives because of lack of formal training. But when you're up in a village in a mountain and it's going to take 4 hours to get to, the nearest clinic, like I don't think we should be picky about that. Okay, so again, many things you can see here. This is a picture of the high school students. You know, the kids will start in elementary school that was provided by the government. But what the families and the missionaries were finding is that, you know, the elementary school only went up to about sixth grade. So, or not even sixth grade, it went up to fourth grade. So when the kids would be done with elementary school, the parents would send the kids into the city, into Guatemala City, because they thought they would be able to work harder, you know, get paid more for different things. But what ended up happening is these kids would be trafficked. So the missionaries said, like, we don't need to do this. They were able to go back into the city, get as many kids as possible at the time, bring them back to the village. And then with, you know, donations and things like that, they built this high school, because they said the solution to that, to keeping them off the streets longer, is providing a longer education for them. So, you know, you have kids that are 21 that are in sixth grade, and you have kids that are on more of the formal track. And the teachers that teach at the school, they travel anywhere from 30 minutes to 2 hours each day just to come and teach the kids. And I think it's just a really special concept. And so we are able to talk to the girls specifically about girl things. And then we talk to all of the kids about nutrition and blood sugar management, because funny enough, soda is going to make it into any village. Like it's just gonna find itself there, no matter how separated it is from just regular grocery stores. And actually, Sabina, the midwife, she's kind of the little shop attendant. She brings the sodas in and she sells them to the kids. So we had to talk with her about making the natural juices, like get the fruit, you know, mix it with water, and sell that to them instead of soda. So hopefully that sticks. But again, just I wanted to say thank you to everybody who helped contribute supplies, because, you know, it means so much to them. It also means so much to me as a professional goal. And we had multiple, Liz really did a stellar job pulling the Rotary clubs together in this North Texas area to help donate, which was super special. So I'm going to pause for a minute, and I wanted to know if anybody had questions specifically on any part of the village trip, because now I'd like to tell you a little bit about Belle and Sparrows, since they are a local nonprofit organization. Lindy was going to be here this morning, but you know, a small situation came up, so she wasn't able to attend. So real quick, any questions before I move on?
Taylor, I have I have a question.
Yeah.
So now you have been going to this village for how long now?
So this is my second trip to the village.
Okay.
But Belle and Sparrows this was their 7th trip.
Right. But so how has this, well, you know, obviously, you know, 4 years of, you know, it's been 4 years, your second trip, but there were, you know, 2 years of pandemic in between. What have you seen changed, and what have you seen improved upon or not improved upon in the length of time that you've been going, in terms of the health and well-being of this village? How many people are in this village, and do you consider this just the village itself, or is it all the surrounding area?
Sure. So there's about 40 families for this village specifically. And, you know, there was one point in the video driving up the mountainside into the village, which we were lucky to get that truck. And normally we have to walk up, which I was super excited about. So there's about 40 families right now, and but there are other villages lower down the mountain that the high school kids can apply to go to this school. But for the most part, the resources of the village are kind of reserved for the village, like the water filtration system or the water purification system they have. It's not advertised that it's there. They want to keep it specifically for the villagers. So there's actually a line outside of the school, or that multi-purpose building, where villagers can just walk up at any time of day 24/7 and get water, which is ozonated. So like what you were asking about, the things that we've seen change, I feel like, you know, I don't know if y'all have experienced this, but when you see people over the last 2 years that maybe you haven't seen in a year, and I don't know, this is just me being judgmental, but sometimes I'm like, wow, you've really aged a lot. like you can see the age on them, you can see the wear, you can see the stress, you can see everything, the toll that it's taken. And I don't know what it is. And I don't know if maybe the community is just used to poverty. So the concept of not having sold or not really having job opportunities didn't stress them out as much, or they were so separated from the thick of it. And a lot of them didn't really realize what was going on. They had no idea how severe the situation had been. So I don't know if it was just being removed from the stress, or I have a theory that it's partially the ozonated water, because these women looked, or the kids, the women, the men, they looked so much healthier than the last time we went. Their skin was clear. They were heavier, because a lot of the women are were very emaciated, especially because some of them have 7, 8, 10 children, and they're in their 30s. Like a lot of the women that's just what they do. They have kids and they take care of the home. And so, you go back and you even compare pictures from previous trips before that over the last 7 years, then you can look at pictures of them from 10, 20 years ago. And you're like, how can you look so much better in 2 years when there's been less resource and when there's been more stress going on? So now, as far as, and whether that's the water or just living in nature, I don't know. It's just my speculation. But what I did notice is that, the women felt very comfortable with us, because when people first started going to this village, the husbands would be with the wives 24/7. If someone was talking to them, like the women weren't really allowed to receive information unless their husband was there to monitor it. Now the women can just come and go as they want. They're not supervised. Even the village elder doesn't supervise them anymore. And personally, from last time my primary focus was to do pelvic floor workshops with the midwives and the women. This time I worked more in a physical therapy capacity, so I had a pain clinic and I was busy treating patients most of the time. And what I noticed is some, not all, but some of the women, they remember, and you can see that kind of sense of like empowerment that they have over their health, versus coming like, this is happening to me, I don't know what it is, give me aspirin, give me Advil or whatever, or what can you give me, versus like, okay, when I move, I notice this. Like they had a different sense of empowerment over their body, which was really, really interesting to me. They also have very different pain patterns. As a PT, everybody's different, and I look at everybody with a different lens. But here, someone comes in with back pain, and it's pretty easy to know, like, okay, here's a few structures we need to look at, because most likely, since you live in the American culture, they're going to be an issue because you're sitting a lot, or this, that, and the other. And the pain patterns are completely different there. They all have the similar pain pattern because they all are walking miles, up and down the hills 24/7, and they're all bending. And the women also wear these really, really tight skirts, not like mini skirt tight, but that textile that they wear, the huipil, there's not a lot of give in it, and they wrap a cinch around their waist, and then the skirts go all the way down to their ankles, and they're just really constricted. So they don't have a lot of lateral movement in their pelvis, but they can also carry 50 pounds on their head and not have back pain. So it was really interesting to see, firsthand the difference in pain patterns and dysfunction. Did that answer your question? Oh, you're muted.
Yes, it answered the question, and it brings to mind, even the thoughts, oh my goodness, yes, their pain patterns, the things that they do are going to be very different. Tell me about, you talk about them bringing in soda. Tell me about their nutritional patterns.
Mm-hmm. So it's a lot of corn, a lot of tortillas, and then black beans. And that's something that even there's a PA that's gone on the trip multiple times, and something she always tries to really emphasize into everybody that she comes across is the importance of vegetables. And despite being in probably the most prolific area for growing absolutely anything, they don't eat vegetables, or they'll eat squash, and that's about it. It's a really specific type of squash. which is good. Like that's better than nothing. But they focus on growing the vegetables to sell in the market versus consuming themselves, right? I mean, you could see the picture of the coffee being dried on the roof. You know, I was having a conversation. There was one lady who she had a UTI, and we didn't have a medical professional with us on this trip that could prescribe antibiotics and things like that. So we were talking to her, you know, we said the midwife student was able to guide her on to go to the doctor and ask for this, and this medication. But in the meantime, because she didn't have money to go to the doctor, we said, okay, here are some things you can do naturally to reduce, you know, the UTI and things like that. And one of the concepts was reducing her sugar intake. So I was trying to walk through, it's like, okay, well, what do you eat in a normal day? Like, how much water do you drink? You know, do you void after intercourse? Like that kind of stuff, which was just horrifying to her. You know, it's such a conservative culture, you know, that's even a thing. But I asked her, I was like, well, how much, you know, do you put sugar in your coffee? And she said, yes, but only when we have it because it's very expensive, you know. So, and even then it's going to be organic cane sugar, right? Probably straight, you know, like directly from the sugar cane. So it's interesting because there's different hurdles, whether it's lack of ability to afford the food, lack of education, and also just scarcity, because they'll have the coffee, but the rooftop of coffee I showed you, that'll make 4 cups, right? So even they can go in their backyard and pick the cherries, you know, it's a process. They have to pick the cherries, they have to let them dry, they have to peel them, and then they roast them, and then they grind them. You know, it really makes you appreciate your coffee a lot more, you know. So and even with the kids, kind of going back to the question of sugar intake. Wait, okay, maybe I forgot what the question was.
You're good. Keep going. Keep going. You're good. Just keep.
Yeah. So, you know, they just don't know. They're just kind of thinking whatever is cheap, easy calories. And that's something that is not just here, but there, right? Like when there's poverty, you do, and you have 7 kids, you know, you're doing what you can. So it's so funny how it can be so hard to get like wholesome food and medical supplies up there. Like it's such an ordeal, but you're walking up and down the mountain and you're seeing like sucker wrappers and Coke bottles and stuff like that. And you're like, how, like, it's just such an interesting concept. So, you know, the big stress, which was really awesome, the nutritionist Whitney, when she was talking to the high school students about you know, importance of water and nutrition, she's like, your body is like a flower. It needs, you know, it needs water, it needs sunlight, it needs this. And it was really cool because you could see the older kids, like their mind was blown. And of course the teachers were in the back like, thank you, keep going. Like we tell them not to drink the sodas, because the teachers that are at the high school are very educated, right? They have a lot to provide, but you know, these kids don't want to listen to them, right? Because they're probably a more consistent authority figure in their life than sometimes even their parents, because the fathers get up before sunrise to go work in the fields, and then they come back after sunset and go to bed. You know, I mean, it's a very, blue collar here is not much different to blue collar there.
Thank you. Other questions?
Okay, so real quick, Belle and Sparrows, a nonprofit organization. It's really awesome. It's really close to my heart, because again, they focus on giving women a hand up, not a hand out. And they do stuff, you can see on the map here, everywhere that they've served. So it's not just about getting exciting and going to different countries, but they do a lot of service here in Dallas. They do it in different parts of the US. A lot of it surrounds around teaching economic stability. And then we volunteer with Exodus House, which is a organization here in Dallas for women who have been recently incarcerated and they're trying to get back on their feet. And it's a home, they can bring their kids, and there's different rules they have, but it's empowering. And then with the different domestic violence shelters in the area, we'll go to New Mexico sometimes. So it's also, the goal is to help women break out of that, the human trafficking and sex trade industries, and also teaching them how to find their way out of abusive relationships. And it is a Christian organization, so there is a lot of testimonies and Bible study and time of prayer, so that, you know, that they can be aware of things that they can put their hope in, aside from themselves and aside from the fact that they need to provide for their kids. Okay, so real quick, they have a branch called the Stella Projects, and it's basically another way that they're serving these women and helping the women in the community get back on their feet. So more specifically, they've just developed a shop in McKinney, and they do candle making. So one of the women that they met at Exodus, I believe they met at Exodus shelter, don't quote me on that because I might be mistaken. She was a woman that had a history of human trafficking, was sold into the system by her aunt, and has, you know, ended up going to jail, has come out of that, and now she's been employed working, you know, making the candles. And so that they've just kind of gotten that up and running, and they're really hoping that it can grow. And they're looking at building a house, kind of like a halfway house for these women as well. Essentially, it'd be like a halfway house. So if you're interested in getting to know more about them, they have more upcoming events. If you're a golfer, or if your partner is a golfer, if you know anybody who likes golf, Brookhaven College and Farmers Branch, there's a golf tournament on April 4th. You can go to their website to sign up, and then Boots and Bells is like a little, like, not square dance, but, you know, a little event, a nighttime of dancing. That'll be in McKinney, and each year they do an ungala, which is a gala, but not fancy. You can choose to be fancy if you want to. I like to be fancy because, you know, few opportunities. But anyway, thank you so much. I'm gonna stop sharing, but any other questions? I know I talked a lot, and I apologize if I talked too much. But
I definitely didn't think you talked too much. It was so interesting, and thank you for walking us through all of that. Did you say the name of the shop in McKinney that's selling the candles?
I don't know it off the top of my head. But I think I want to say it might actually, hold on, I think, let me Google it real quick, because it might just be Belle. You know what I think it is? I think it's their storefront that Belle and Sparrows actually has like a physical location now, and they're selling out of that.
Okay.
And they actually, so we did talk, I will say, because this is a group that would value this factor, is currently their candles have like artificial fragrance. So we're working on, or I encourage them to work on a essential oil line. So they've just ordered the essential oils to start making
Awesome.
not fragranced candles, for artificial fragrance.
Taylor, did you say how you initially got involved with Belle and Sparrows specifically?
I didn't, but I was a part of a networking group called Hustle and Heels, and it was a female exclusive, like there's the men's club, so it was like the ladies club. So I met Lindy in that group, and it was funny because she said, "Oh, you need to go to Guatemala with us. We go on a trip," and I'm like, you and like the rest of the world, because I kind of had a definitely jaded and like because this was my 28th trip to Guatemala. My grandfather would fly us down every summer, and so I'd be in the airports just like watching these missionary groups come in, and it's like, okay, you're gonna go paint somebody's wall and then go to the beach for 5 days. It is just very like, what are you doing? So it was really humbling and encouraging to me to see that people are like taking that step to make relationships and not just, do whatever.
Yeah.
So.
Any other questions?